Okay, as a preliminary matter, I'm Mary Ann Easley, Chair. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. So members, when I call your name, please respond in the affirmative. Allison, you're here.
Here.
Diane is not here. Vanessa,
Here.
Kendra,
Here.
Jude,
Here.
Susie is not here but may be joining us. Nancy,
Here.
Linda, we hope to get later, and Mary Ann Easley, myself. Staff, when I call your name, please respond in the affirmative. Jericho. Here. Laura.
Here.
And we have no anticipated speakers for this meeting. Good afternoon. This open meeting of the Council on Aging is being conducted remotely pursuant to Chapter 20 of the Acts of 2021. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. For this meeting, the Council on Aging is convening by video conference via Zoom app as posted on the town's website, identifying how the public may join. Please note that this meeting is being recorded and that all attendees are participating by video conference. Excuse me, but they're starting to mow my lawn. Sorry about that. Accordingly, please be aware that other folks may be able to see you and to take care not to screen share your computer. Anything that you broadcast may be captured by the recording. All supporting materials that have been provided members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. Just to remind you, a couple of the ground rules, please mute your cell phones, that would help. And please speak clearly because that helps the secretary. And also identify yourself when you're speaking, also for purposes of the secretary. And on the subject of the secretary, we need somebody to volunteer to be our secretary just for this meeting because Diane could not be here. So can I get a volunteer, please? Hello? Out there in Zoom land. It's just for this meeting.
Oh, all right, I'll do it, but you've got to bear with me. Huh?
Kendra, you're the champion. Thank you.
Well, I don't promise very good notes, but let me get a pad.
I can help you, Kendra. When I go see hot martinis or pink martinis with her this month.
Okay, I can't because I don't have any paper. Okay, sorry.
One thing is this meeting is being recorded, so if you have gaps, you can always look at the recording, just to
True.
let you know.
Excuse me, guys. I have to go basically immediately. I'm going to transfer the hosting to Laura. Laura, just end the recording when you're done with this. Apologies. I will talk to you all later.
Okay, thanks.
So the first thing that we have to do is approve the agenda. So if I could get somebody to move to approve the agenda, that would help.
Allison moves to approve the agenda.
A second?
Second.
Mary Ann, did you say you were second or I will second?
I'll
second. Wayne said second.
Allison was first, Vanessa second.
Oh,
Thank you.
Then I have to go down the list for approvals. Allison,
yes.
Vanessa? Yes.
Yes, yes.
Kendra?
Yes.
Jude? Susie?
Yes.
Nancy?
Yes.
Mary Ann, yes.
Oh, Nancy Swain is on? Oh, good.
I am.
Yes,
Oh, good. I didn't see her. I didn't hear her name. I'm sorry. Oh,
She's
hi,
not,
Nancy.
she's not on video.
How are you, Kendra?
I'm good. Okay. All right.
Next on the agenda was approval of the minutes of the last meeting, but we don't have them, so we're going to have to move that approval to the next meeting in August, or I mean in September. The town of Nantucket insists that we elect officers once a year, and our current officers have been in office for a year now, so it's time for election. So
I
that's the next
nominate
thing.
Mary Ann Easley as the president.
I second.
All in favor?
First, second.
It's out of control.
Yes.
So we need to go first for chair, second for vice chair, and third for secretary. And I'm going to ask for nominations and then a vote on each of these. So I'm going to ask for nominations first for chair.
I nominate Mary Ann Easley.
I second that.
Do we have other nominations for chair?
All in favor, aye.
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 What was that?
That's how you call whiplash voting.
Well, you're going to have to take the minutes of this. I guess that establishes that I will continue as chair for another year.
Thank you
Thank
very
you
much.
very much.
I'm not going to do anything. I've got a big project coming up, and I want to stay on the board, but I'm not going to be any officer.
Oh, and I wanted to nominate you, Allison, to continue as vice chair.
I'm vice chair now?
Yes, you are.
I think someone else.
You
can
can
have
do
the
it, Allison.
No, someone else needs to have the opportunity.
Is there somebody else who'd like to have the opportunity? Is there somebody else who'd like to nominate somebody else for the opportunity?
I'd like to nominate Nancy Swain.
Please don't.
I
I'm
didn't,
brand new to the board. I'd rather sit back and watch this.
I didn't even
unfold.
know I was vice chair, so that's how easy it is.
Well, why don't you just continue then, Ally?
Okay,
Good.
I second that.
So we have a
Write
second.
down.
So you want to vote? All those in favor of Allison continuing as vice chair, I'm going to go down the list. Allison,
okay.
Vanessa,
Yay.
Kendra,
Yeah.
Jude. I don't know if she's here. Susie,
No, Yay. yes, okay.
Nancy,
Didn't know if I was muted.
Yes.
Marianne, yes. So it's official, Allison, you will continue as vice chair. Now secretary, currently Diane is serving as secretary. And I'd like to
Let's
open up-
nominate her because she's not here.
Good idea.
Are there any other nominations?
Diane, put her back on. Nominate Diane.
Okay, so that's a second from Susie.
Okay, wait a minute.
So nominated by Allison, seconded by Susie. I'm going to take a vote going down the list. Allison,
Yes.
Vanessa,
Yes.
Kendra,
Yes.
Jude,
Yes.
Susie,
Yes.
Nancy,
Yes.
Marianne, yes. So it's unanimous.
It's anonymous.
So Diane is our secretary for another year, and I'm sure she'll be delighted to get that.
Yeah, I'm sure.
So we are continuing with our slate of officers from last year going forward. And thank you, everybody, for your participation in that. Okay, now on to official business. First thing on the agenda are the federal grants for which at last meeting, we talked about making 2 applications. Allison, you were doing one for people with dementia to have events, and I was doing one for seniors who need modifications to their homes, like grab bars and that sort of thing to get them. So Allison, do you want to give us an update on your grant application?
Sure, it would. it isn't coming from me. I'm just helping NAMI put it together. And
Who?
Nantucket, no, National
NAMI?
Alliance for Substance Abuse, no,
For mental
mental,
illness.
It's
Yeah.
actually
Yanni,
Nantucket.
no, it's a national, it's,
Mental
we're part of the Cape and Islands group, and it's,
isn't it NAMI? NAMI? Is it called NAMI?
yes, Nantucket, National Alliance for Mentally
Mental illness.
Illness.
NAMI.
Correct, NAMI. So someone was in touch with me about the previous memory cafes that got started with Taylor back when she was Human Services Director, and we had one, and then COVID happened. So everything had been put into place, and as things are starting to reopen, I think I mentioned to somebody to Sue Mittenthal about the Title III grants, and then she was on it. So along with Jackie Lane, I think she's the executive director of NAMI for Cape Cod and the Islands, they put together an incredible application. Or Marianne, what's the second? First we did is it an RFP? Whatever the second phase of this is.
Grant application because it's the final thing.
Yeah, so we should learn by the end of August, but it was really incredible how they combined information. So the interesting thing is that because of the Nantucket Center for Elder Affairs and their Aging on Nantucket, the community assessment, seniors are expected to rise to 25% of the population by 2030. And according to the World Health Organization, people over 60 with dementia are generally between 5 and 8% of the population. So that is suggesting that right now, just in the people over 60, there could be approximately 90 to 143 people on Nantucket living with dementia. So there are no programs, they are unidentified. And they have a great advertising budget. And if we are to get what we're asking for, which is I think $7,000, we'll be able to have 2 memory cafes a week. We're gonna be able to offer, what do they call them when there'll be a budget to have speakers. Is it called memorandums when people do things for anyway, I mean, I won't read the whole entire report because it's 7 pages long, but yeah.
So
And-
they wrote this grant, I mean, is that important for me to know that they wrote the grant
Yes,
for?
yeah, it isn't me as a member of the Council on Aging that wrote it, but I'm
They
working.
wrote it for us?
Yeah, and so it says, the following groups have already expressed support and offered to help with outreach and collaboration. Elder Services of Nantucket, the Salt Marsh Senior Center, the Nantucket Community School, the Nantucket Community Music Center, and Joe Revere's group, what's that called again?
NCEA.
Yes,
Can I
NCEA,
ask a question?
And Council on Aging?
yes.
So my question is, Rachel sent me a copy of that grant that they wrote.
Uh-huh,
And it says, as you just said, that the Salt Marsh is on board.
Yep.
And that was the first I've heard of it. So I didn't know I was on board.
well, I think this came from the dementia friendly workshops that the NCEA paid for. And so, and because I'm on the Council on Aging, they felt that this, I mean, I was the one that said the Salt Marsh Senior Center was on board. Was that wrong?
Well, it was just a surprise to us. I didn't know anything about this grant. I didn't know that they were doing it. Last I heard, I thought Human Services was going to do something about it, which is fine.
Yeah.
Rachel and I were, she asked me, you're on board, what is this? And I said, I don't know. I don't know anything about it. So my point is, what are we on board for?
Just express support.
Okay,
Allison discussed this pretty much at length at our last meeting. I'm not sure if you were there, Laura.
Laura wasn't there.
I was
No.
at that one.
Oh, okay, well, too bad, because a lot of this was
So that's
discussed.
why I'm in the dark.
Oh,
Okay.
Too bad you
And I
didn't-
don't have the minutes to read either, so.
That's
oh.
Okay.
Yeah, I guess I did explain it. So it's basically, one step in the right direction for Nantucket becoming a dementia-friendly,
Right,
community.
I read the grant. I read the
Oh,
whole
good.
thing. So I understand it. I just didn't know anything about it because I missed the last meeting. So, and
Oh.
we're happy to advertise that in our newsletter.
Great.
Definitely. I just wanted to make sure I wasn't responsible for anything specifically that I'm not doing, that I should be doing.
Well,
Can you-
surprise, you're getting $7,000.
Yeah.
Can you mention to Rachel that we discussed it at the last meeting, so she doesn't feel like I'm operating as a satellite?
Yes, that's why I brought it
Okay.
up. I certainly will. And there was just the lack because I wasn't there.
Great, because actually Jericho asked me what was going on too. I'm like,
Yeah, because he was on, because he's my boss and Rachel's our boss. So
Right.
we're all on that email. And so that's
but-
why. Okay, I will email her and let her know.
yeah, other than support, I mean, we're gonna work through, it's, NAMI is going to be the person who hires and
Right.
facilitates these, everything. So we're just gonna include, and we'll be included in all of the information about the memory cafes that are gonna be made public.
Got you.
Because,
I'm
you know,
happy to advertise.
And so we're sort of, they're gonna distribute the money, but we're gonna contribute whatever we can to find people to attend and to publicize what's happening.
Right. Okay, great.
Yeah, no, it's, really exciting. So,
Yeah, I'll
um,
share that.
great. And so that's mine. So does anyone have any questions?
Thanks, Allison.
You're welcome.
Hey, Allison, your
Yes,
screen is very fuzzy, and I'm wondering if your camera,
Yeah,
Means-
I was gonna
No, I
say,
think- I
not
think
clear at
it's-
all.
your camera might be need to be wiped.
you don't think I look beautiful like this?
Oh, did you
put
do
an
the
H on
Vaseline
yourself.
over the camera?
I'll work on it.
So the other one of these grants was applied for on behalf of it was the Council on Aging. We have submitted a grant application. And this one is for home modifications for seniors who might need grab bars or non-slip tiles or a ramp or something that needs installation. And I requested $7,500, which I estimated would help 15 seniors on Nantucket. And I said that we would start with those few seniors that have already been identified by the fire department, because seniors who participate in the fire department's Generation Safe program, which is when somebody from the fire department comes into the senior's house and changes the batteries in the smoke alarms, but also gives a look around the place to see what's needed for safety reasons. So the fire department has already identified a few seniors who could use things like that. So I hope we're not competing with each other. I hope Nantucket gets both of these grants, and we should know by the end of August, as Allison said.
I think that there's another one as well that that PASCON goes for. Laura, do you know how we can get copies? I mean, I just have the drafts that we worked on. Are copies of the applications available anywhere so we can see if PASCON put one in?
Oh, to see if they put one in?
Yeah, I mean, if Rachel could see that NAMI put one in, maybe we can see if anyone else did.
How would we know that they submitted one?
Well, the reason why she knows about NAMI putting it in is because they were forwarded on it, on the email. She doesn't know prior.
And so maybe ask Rachel if she has access to all of the people who put in for the grants.
I don't understand how
see.
she would know.
Well, she knew about the NAMI one.
That's because she was copied on an email.
Rachel wasn't.
Yeah, Laura just said Rachel and she and Laura and
It was from
And-
Rachel.
It
So,
was-
okay, I'll ask her. I just don't,
Okay, yeah,
that's fine. I'll
I'm
ask her
curious.
if she knows who else has applied for Title III grants.
I mean, it's probably public record. I just didn't know where to look. I didn't know it was,
I would think it would be public record if you get the grant,
right.
but not if you applied for it. So I'll ask her.
Okay, great. I
Any
hope
other-
it's not a competition thing.
Pardon?
I hope it's not a competition thing.
Well, it is a competition because there are only so many dollars available. So it depends on how many applications they get. They have to
Right.
apportion the money that they have.
and we should have done it under the umbrella, but I guess you have to do either dementia or the modification.
Well, I think it's fine what we're doing. It's just that we may be competing because I'm imagining being on the deciding body saying we're giving too much to Nantucket, as opposed to
Maybe
any
they'll
other.
just give less.
Yeah,
than we
I
asked
hope we-
for.
I hope we get both of them.
Yeah.
So,
Okay.
next topic on the agenda is the adult health fair, and there are a number of us who are on the planning committee. So I'm going to let somebody else talk about the experience of how we had our first meeting.
Marianne, I'm sorry, what was it called?
Well, the hospital is calling it the adult health fair.
Adult health fair.
So I'm wondering if those of you who attended the meeting and are on the planning committee want to speak about this. Susie,
I'm gonna let Susie do it because I'm in line to get on the boat and it's gonna be confusing for
I
me to
actually
talk in a minute.
Jude, if you want to talk, because I missed the meeting, I had to show property, so.
Oh, well, I can talk quickly about it, that it's going to be a flu shot, outdoor flu shot. I think no place has been selected yet. They're looking into, and correct me if I'm wrong, the portico at the hospital, the VFW, I think the hospital was the more positive one, and it's just going to be in line in your car, I guess, and maybe with some gift totes that I think were left over from last year with some information yet to be known to put in
So,
it, is what I
Sandy,
gather.
Is it not going to be?
And I forget the date.
It's not going to be the regular health fair then? Like,
No, because of
vendors.
COVID, I think. It's just, yeah, no
Okay.
vendors.
I have September 25th as the date. I don't know if that is still
Okay.
the
That's
correct
I
one.
just don't have a notebook that I, had with me at the time I listened to that. So yeah, September 25th.
Good.
I'm sorry, I'm a tad confused. So it's just flu shots?
Yes, I believe it is just flu shots.
Well, if it's just flu shots and no vendors, why is it called the adult fair then?
I don't know. Can't answer
Marianne,
that.
do you have a recollect of what, I mean, what do
Well-
they got volunteers for? I mean, what is it all about?
well, the hospital initiated this whole thing, Kathy Ward on behalf of the hospital. And when they invited us to participate, they called it the Adult Health Fair. And when we actually met, that was the beginning of this new spike with COVID and the variant. And as we talked about it, it just didn't make sense to put hundreds of people in an enclosed space. And the hospital had already decided that they were refusing to allow us into the hospital for this purpose. So that was another reason for us to consider making it a much smaller event. And I'm not sure that it makes sense to invite vendors at all. We're not giving them much lead time to figure out what they want to do and where would we put them. We haven't been able to identify another location like the VFW if we can't use the hospital. And to tell you the truth, since that last meeting, COVID has gotten worse on Island. So I think we're probably going in the right direction. And we're having our next meeting tomorrow. So we may even change the name from the Adult Health Fair to what it really is, which is
Flu
Just a
shot
flu-
clinic.
It's a flu shot parking lot thing, and it's not even, I mean, sounds like that's simple. I mean, the health fair is gone. It's not happening again.
Yeah, you're right on
Well,
that.
maybe they should announce that there's no health fair. Come get your flu shots.
Well,
Have they
that's
done
the
any,
subject of tomorrow's meeting, so
Yeah.
I hope you're going to be there.
Will it be a drive-through flu shot due to COVID and
yeah.
whatnot?
Yeah,
So, so is Courtney O'Neill involved in that?
She no longer works at the hospital.
No, yeah.
So, yes, it's interesting working with the hospital. And there are also 3 people from the NCEA who are participating in the planning. So I think tomorrow will be, we've only had one meeting. Tomorrow we'll probably nail down some more specifics. And one that I can share is I took the assignment of checking in with the Visiting Nurses Association of Cape Cod. You may recall that in the past at Elder Expo, they were the people who came and did the flu shots. They're from off island. They brought in nurses and they brought in shots, and they were the people who actually administered the flu shots. So I've been in contact with them. They'd love to participate. So I have invited them to come to our planning meeting tomorrow. So I'm hoping that she'll be there. Sorry, I can't remember her name. Meg something.
I mean, we
Um,
do have, we've got a town nurse now, and there's a group that has been vaccinating at the high school on the Wednesdays and Thursdays and Sundays. So I don't know, do we have to pay them or?
What does that mean, town nurse?
Heather Francis is she's the town nurse. We
But-
didn't have one before.
Public health.
Where is she out of? Where does she,
Out of the health department.
huh?
And I have a question of why the health department isn't part of this whole planning. It seems like they should be, but that's a question for tomorrow's meeting as well. The hospital is
Question
dry.
for Jericho?
Yeah, that sounds like a Jericho question.
It sounds like it's not even the hospital funded or backed or anything. I mean, it doesn't, so Kathy Ward is kind of taking this over to be just a flu shot something.
but they're gonna do the graphics and I think advertising. They had a, I don't know if it was a public relations person, but anyway, they were gonna get back to the meeting, I guess, tomorrow with some graphics and a logo.
And so with the flu shot would be given to older people.
I think it's for all adults.
I've got a suggestion. We already did a logo for the Elder Expo. Maybe we can just call it the Elder Expo again, but say, instead of there being an in-person gathering, it's going to be focused on what the Elder Expo has always been focused on, which is the flu shots. I mean, that's what we'll come to the Elder Expo for. So instead of bringing a new logo and why don't we just be the reimagined expo that turns into a drive-through vaccine
It's
clinic?
not just going to be elders, it's all adults. So you don't have to be a senior to come and get a flu shot.
Oh, okay.
And I
Okay, so, I'm
There's
sorry, this just
resurrect-
clicked in my head. So I know that Rachel is working on a website for everybody to come together and like have all their information on it. Yes,
That's Jericho now.
so that's Jericho now.
He
So you
inherited.
drive up, you get your flu shot, and then why not a business card with an RQ code that can click and lead you to that website or a list of all the previous vendors that we've had in the past for the expo. So you can just
Good
pick and
idea.
choose which one you
Ooh,
want.
that's a great
So-
idea.
So everything is in fact, safe and everything is online and you do you. Does that make sense?
Yeah.
Yeah.
That is a
Yeah.
great idea. I happen to know that Jericho just inherited this project, so he's looking at improving it. So we can.
But I'm
pass
just
that-
saying, like, if we're gonna change it to the flu shot clinic, then might as well just be like, okay, technically it's the senior expo, use this, this scans here, this clicks to all this, etc.
Yeah, right.
Vanessa, what did you call it? RU?
So it's an RQ, so it's a QR code.
You-
Yeah, QR,
Yeah.
Get
okay,
it from your phone,
right.
and you just hover over it like at a
Right.
restaurant to pull up the menu, etc.
Right. And
I
then
just-
everybody that was on the vendors from years ago. would
Exactly.
be-
That you
that
can
they could
contact
come
them.
up.
What it would do, it would bring
Yeah,
you,
nice
to the-
idea.
it would bring you to
I-
the site. And then you would, it would bring you to the site that
Right.
Jared was working on. I can't remember what is it called again?
I don't remember.
Something.
It's just
with-
a Q, it's just a Q code. But
I
I
mean,
have to
even
say
if
that-
even if it's a Q code of just a simple like Microsoft Word doc that says, okay, to reach the fire station, their website is this, their phone number is this. To reach, you know what I mean?
Yeah.
Yeah, so it's all under one umbrella.
One.
So
Can I suggest we don't use the Q code and we just have little little cards like your credit card that has everything on it, because 80% of the people do not know how to use the Q code. With all our rentals, we decided this year we were going to have a little Q code, and it's rectangular, fairly big. No one knew how to use it. Strange, but true. So it seems more logical to just
Oh.
put it on something like a health card or something that has what everything is and the number.
it would
Small
be a
enough
pretty-
for
It would be a
everybody.
pretty big card.
Well, maybe something that folds over.
or just has, or give them the card.
Well, if it opens up like a regular business card, there
Like-
can be
like-
directions on how to use said.
Yeah, that's
QR
what I,
code.
Like it could be something like, let's just assume this is 3 things. It could be like this, and you open it up and it's got, three different sections it's small enough but big enough so that they'll be able to have all. I just think the Q codes are not working for a lot of people.
Remember
I'd like to
this?
take- I'd like to
Cute.
take the time to teach people how to do it, because I think it's going to be really helpful for this population moving forward to know how to access.
I
I
think that we need to
Menus
teach
and-
them. Exactly.
mean, we can do both, but
I think Mary Ann put this together a couple years ago, the senior services on Nantucket with all the services, something like that.
Right.
That
There could
you
be a
could do
QR code
something
for that.
local, and you could also do something, if you're gonna get all the other vendors that were here, you gotta start moving. But even just this local one would be cool.
do you have that electronically anywhere, Laura?
Well, hang on a second here. I did this with Shaylin McGuire at the hospital. She is the graphics person who's doing whatever we're going to look at tomorrow's meeting. So she has it on her computer. The hospital was very helpful in this regard. So if we have any changes to make to it, we can do that.
Well, Marion, why don't you let us know if you need help? You would, as the, you three as the committee, because we don't need to micromanage this, but you let us know if we can help you.
Well, thank you. And these have been great ideas that we can pass on at tomorrow's meeting, and we're well represented at that meeting. So thank you, everybody. It's been great. Good suggestions. I'm sorry that I think this thing is going to turn out to be something really small, but I think given the recent spike in COVID, I think we're just stuck with the reality of it. And maybe next year we'll bring back the whole health fair / elder expo in its old glory. I'm hoping that'll be the case again.
I think
Anything else?
Jericho's not very optimistic that we've hit the even spike yet. So looking at a month and a half or 45 days from now is not going to be a safe gathering kind of situation.
Yeah, I would agree with him on that.
So in that's the case, then it's going to go to nothing.
No, it's going to be, we have to vaccinate people against the regular flu. So it's going to be
Right.
something. Yeah.
Mary Ann, would they have the vaccine available there too? Do you know if they were offering that?
The hospital would have the vaccine, and I'm not sure if the visiting nurses brings additional vaccine. We'll probably learn that tomorrow at our meeting.
So the
The,
hospital is offering the vaccine. They're just not offering you a place to do it.
the town is offering the vaccines for free. So we could invite the town to the clinic.
Regular flu shots?
No, 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 no.
No,
No,
we're
we're
talking
talking about
flu
COVID.
shots here. Oh, what are we talking about? COVID or flu?
I was asking if the town, the hospital was offering not only the flu shot, but also vaccination.
I don't know.
Oh, okay.
Maybe ask them, Marianne, because if they don't, maybe the town could do that.
Well, I sort of think it would be nice to have Jericho or somebody else from the health department at these meetings. It seems like everybody who's a part of the solution should participate. So maybe I'll give Jericho a call and see if he could come to tomorrow's meeting. I'm not in charge of it, so.
You know, the town is working with the hospital on a regular basis with the COVID updates and everything. So there already is a partnership there on COVID. The town should be invited, I think, for the flu shot thing, but I don't know.
I agree. Well, I definitely agree because there's so much overlap.
But there's also so much ownership. I mean, the hospital might want to own the flu shots and the town now owns the vaccine. So
To be determined, but
yes.
all good suggestions. So thank you, everybody. Next on the agenda was Jericho making a report and he is not here.
Can I say one more thing before we move on?
Yeah.
I had somebody yesterday who was trying to figure out if she had COVID or not, and she was trying to go get tested. She couldn't get tested anywhere. And why is it that some like places you have to pay $150 or whatever? If you go to the hospital, it's free. What do we know the reasoning behind that? Like if you go to Dan's, you pay money. But if you can get into the hospital, you don't pay any money.
Right. Well, the pharmacy is not doing free. They don't do free. You have to pay for it or your insurance company pays for it. But the
You want me to give
hospital
a stab
has,
at that?
huh?
So I overhear Jericho talking. I mean, tonight at the select board meeting, I mean, the state has sent a bunch of 15-minute at-home tests to Nantucket and they're distributing them at the Board of Health. And they're free and they're nasal swab, 15-minute COVID test. They're vaccinating, but they don't test. And there can be a really long line to get a free test. People have been turned away. So I don't know how they're going to distribute the tests that the town has, but that could be helpful for people that are looking for something that's immediate. So
Yeah.
So
What?
if you go to Dan's or the dental or whatever, and they actually charge you, then you can take the receipt, just submit it to your insurance.
But they don't pay the entire thing.
Well, it's
The
whatever
insurance?
whatever.
No, I don't
your
think they
copay
pay
is.
the whole thing, but I could be wrong. Anyway, I was just curious to know because this was an older person who was trying to figure it out. In any event, she got an appointment today at 1:30, so at the hospital, but I was surprised that it was so expensive to go to Dan's or to go to ACKI or wherever they go.
Oh,
and they're
Alice,
different.
I heard those 15-minute tests from the health department, you can just go in and pick them up.
Yeah.
They're
They were
right in
trying to
the
work
door.
out
You
some-
walk
They're
in
trying to
the
work
door.
out some kinks about how the scan tool isn't working. So, I mean, they're figuring it out right now, but you can just go pick them up. I mean,
Mhm.
I had company come, and so Jericho suggested that we all test before we spent time together because they're coming from off island. So, there are quite a few tests available. I don't know how they're gonna, they are available to be picked up, but so far getting the word out to people has, they're trying to figure out the best way to do that.
Yeah, good. That'll be great when that happens.
Watch the select board meeting. Jericho's going to be on it.
Oh,
Well, also with all of the early morning emails from
Hey.
Daybreak and everybody else now,
I'm in the middle of a meeting.
every one of those should cover everybody's millions of questions about getting tested and getting the shots. Take advantage of those come out every day now practically. Well, Daybreak is every day.
It doesn't mention cost though.
No, it should. So people aren't surprised.
Well, I bet you if you click on the link, it probably does, maybe.
Hmm,
Yeah, that's possible.
I'll try it.
All right, sorry about that. Moving along.
So Laura, you're next. What's going on in Salt Marsh?
So masks are now mandatory at the Salt Marsh and all town buildings, which isn't a problem. We have them here. People completely understand. We are now Zooming Nancy's class in the morning because it's hard to breathe through the masks with all that heavy exercise. And Hannah's class on Wednesdays and Fridays is now canceled just because they work out too hard also, and using a mask is just not working out for them. I did find them a space out at the new Tom Nevers Field, but they decided that doing it outside was not the best idea. There's no shade, there's only porta potties. So anyway, it's on hold. We're going to see how this whole thing pans out, and we'll go from there. With that, like previously, we had some land council walks outside, which were very, very well attended. They were excellent. I did get something from Cisco Brewery to have a tour, but with everything going on, I decided that it's just not a good idea to kind of advertise that kind of thing. So they will let us do that later in the year or whenever, when things start to get better. What else? So we have our hearing lady who comes once a month. She's always fully booked. We now have our other gentleman, Sean, who comes from At Home Hearing Healthcare. So he'll be here once a month. He was also very fully booked. So that's good. And the legal advice with Arthur Bergeron, which is either a Zoom or a phone call. Surprisingly, he's been booked for the past 3 months, which is just interesting. So things are going well here. The population has definitely dwindled a little bit. You know, there were like 2 people in yoga yesterday. We have 2 tables of mahjong. So I don't know, people either have guests or they decided that it's safer to stay home. So we're just trying to stay safe so we can stay open for the people who want to come down and join us and play games.
Does everyone have to be vaccinated to go there?
We can't ask that question.
Huh.
So no, they do not have to be
So-
vaccinated, but they
So
do
that's
need
a
to
good,
wear masks.
that's good news then that they're wearing masks. I will tell you that I have my very, very closest friend, she's a scientist, and she invented a cholesterol drug 2 years ago and has also invented some other really cool drugs. But I spoke to her on the phone last night and she said, try to convince anybody and everybody to get this shot. Try to tell anybody you know, try to tell them that all they're going to do is they carry whatever this new Delta virus is. It's transmitting faster than you can say whatever, and people are dying, and it's worse than ever. And she said it's now going into the kid syndrome. So parents who aren't getting the shot, they're more susceptible to transferring it now to their kids. So anyway, she said it's really terrifying. And living on Nantucket, I don't think we really see it as clearly as the rest of the world. I don't watch that much news, but I probably should watch more. But it's scary stuff. And this is a big deal. So it's unfortunate that we can't ask anybody, hey, have you had your shot? We only want you to come in if you've had your shot. I do think it's interesting that certain restaurants are now asking people to come with their vaccination cards or they can't get in.
On Nantucket?
I'm just,
They can do that because it's their private building.
yeah, they
and
own the business, right? So they can actually say, we are not serving you dinner unless you have a vaccination card. And they're starting to do it on certain airlines too, which I thought was intriguing.
I can say here that the seniors aren't, they like to say that they're vaccinated. So I would bet 99.9%, I would say 100% of them are, because they all say, well, I'm vaccinated. You know, they're smart. They don't want to die. So it's the younger people who think they're cool.
A copy of my vaccination card is actually on my waitress pad, and everybody at IK wears masks.
Great. Everybody who works there, you mean?
But for like privacy issues, because it has our name, our full name and our birthday, some people won't put it on their waitress, but I do, because I want my people to know that I'm,
That's great, Vanessa.
but then they question, oh, what about your birthday? And I'm like, well, it's in February, send me flowers.
So
Funny.
Laura, I have a question about the salt marsh. Last year, the drive-through things that you did that Kendra worked on and provided all the goodies,
Yep.
so successful that I'm wondering if they can be resurrected when the summer ends and we're all still having nice weather and can be outdoors. Is that a possibility?
So we did get a grant. I think it was for $1,500 to do something like that. And then of course, COVID was over.
Hmm.
So we thought, oh, what are we going to do with it? So we do have that money. And I'm sure NCEA would be willing to help out. I wouldn't think we would get a grant from CFAN like we did in the past, just because it's not, you know, a shutdown emergency type of thing. We would need to find a caterer, somebody else other than Kendra, because she's not here anymore,
No.
to do something like that. So if anybody has any suggestions, and obviously, you know, in September when it slows down, because they're still busy doing weddings and whatever. So, I mean, or we could just buy stuff from Stop and Shop.
It was so simple when you did ice cream that maybe something that simple could be done again.
Oh yeah, definitely come September. I mean, even just, you know, coffee and a muffin. We can make the coffee here, which I just found out. So that's, will save some money. And we could really just get, you know, 40 muffins from Stop and Shop. And the point isn't the food. I mean, it is.
It's the social, right?
It is. I mean, and a cup of coffee and a muffin isn't gonna, you know, really satiate anybody, but it really is just for the socialness. I mean, and if things do get worse down the road, and doing another meal program would be great. But the only way we did that before was because we had all that money from CFAN. It was a lot of money. So that's a whole different ballgame. But a small little thing, an ice cream thing or hot chocolate, and definitely.
Any other questions for Laura? Okay, we're going to move on to Allison. Do you have anything to report on dementia-friendly Nantucket?
Well, so there is there's an Alzheimer's Associate, AJ Malesko is doing an ice challenge, something for the Alzheimer's Association, which I'm going to go to as a you know, as a paying customer, because I mean, I've worked with the Alzheimer's Association, and what they're into is fundraising. And so none of the money that the Alzheimer's Association raises comes back to Nantucket. So I sort of am in support of what they do, but looking for ways to bring services and awareness here on Nantucket. And so that's, I'm hoping to network with some people there who also
Well,
have.
her mom has Alzheimer's, and so that's why she's doing the benefit. But that money doesn't stay in Nantucket that she's doing?
I don't know if she's made a special arrangement with the Alzheimer's Association, but
I would think she'd want to put that towards Nantucket. You might want to give her a conversation on that, because
yeah, no, I'm gonna go. I mean, I just worked with the Alzheimer's Association before, and the money, you know, the money goes to research, and research is
Right.
not regular support.
Where does the money go on Nantucket if it was going to stay on Nantucket? Does it go to the town?
Well, that, you know, it all depends for what purpose. So once,
Fundraising money that she's got, AJ's getting.
I don't know where it's going, but it's being sponsored by the Alzheimer's Association, and the Alzheimer's Association doesn't run any programming here. What the Alzheimer's Association raises funds for is for research.
So
You know,
that
they
money
do-
that she's going to raise here isn't going to stay here.
I don't know what arrangement she's made, and I will have a conversation with her, if not before, then at the event to find out, but, I see the Memory Cafe as the first step for dementia friendly, which will be a town initiative, but it's always been my interest to get a program running for people living with Alzheimer's and their care partners. And so that's going to happen. And there'll be a core group of people who are out and about and identifying as dementia friendly, so that's when the dementia friendly thing is going to come into play, I think. So I don't have an update on the program as a whole, but once the whole Memory Cafe thing gets kicked off, we'll have a body of people who are gathered that can then help us with the dementia friendly part, because I've talked to Jericho about if that's a priority for him, and it's not right now because of COVID. But once things get under control, things like that are something that I think the Department of Human Services on Nantucket would be interested in supporting.
Is the Memory Cafe literally a cafe that people would go to? And I'm sorry, I can't.
Yeah, and so Memory
So is
Cafe,
that going to happen with the COVID back up again?
the whole COVID, but I mean, that's just, we'll have to follow the health department's guidelines for that. We don't get the money until at least, the awards we find out at the end of August, but things aren't funded until October. And then, getting it set up, who knows when it's going to happen, but we'll have to follow every guideline possible. So, but yeah,
So this is another silly question. If you decided to do something for Nantucket for your dementia cafe or whatever you want to call it, is it possible to raise money? Like you could have lemonade stands that said for the benefit of the cafe, and would that money go to you, or would it have to go into another kitty somewhere else?
Who's me personally?
I'm just saying, if you created
Yeah.
something to raise money for your dementia cafe, does it have to go into a general fund? Does it go to you for the creating? Because you're
And
always
so-
saying you have to raise money. We could probably find ways to raise money.
And so here's the
Dementia
history of that. We were looking for a 501c3 to be the umbrella, because there has to be some way for people when they donate to get recognition for it, or and the Council on Aging is part of the town of Nantucket. So if the town of Nantucket were the people who collected the donations, it's not a very easy ask. Oh, can you, so now that NAMI is taking over being the umbrella, people who would like to sponsor a Memory Cafe can donate to them,
I
and they
see.
will put it in the Memory Cafe kitty.
So my question to you, Allison, if you get this grant, the check is going to go to NAMI, which is a national, right? Or is it earmarked for Nantucket?
Oh no, it'll be earmarked for Nantucket's Memory Cafe.
Can I say something to Allison?
Yep.
Having gotten into the weeds with this grant, part of the grant is that you have to, when people receive the services, you have to ask them or tell them that you're open to donations. So NAMI has to say at every Memory Cafe, we welcome donations. You can't pressure people, but you have to say we welcome them. And all those donations have to go directly back into this exact same program.
Yep.
So that does mean money will be coming not just to NAMI, but specifically into these memory
Program, yep.
So.
Yep, and so, and the grant is only good for 2 years. So hopefully in that time period, funds will be able to grow or,
And
will be able to be sustained.
Like, who takes care of the money? How would you, where does it go?
NAMI.
And so who do you ask for NAMI? Sue Mittenthal, those people?
So they're going to hire a facilitator.
Oh, okay.
And
What
so the
about, Marianne, I'm sorry, what about the money for, if we get the grant, does that go to that we don't get money, it goes to the town?
No, Rachel is going to establish a special budget
Okay,
just for these home modifications for seniors. So if a senior decides to contribute their own money, it'll go into this special budget and it has to be used for other seniors to get home modifications.
thank you.
They're very specific about this, that's for sure.
Yep. Yeah, and so, hopefully our conversations can turn more to dementia-friendly Nantucket once COVID is a little more relaxed. Because that's something I can see the town participating in.
Anything else on this subject?
No, but do I look a little less Vaseline-y?
No, you're still a little foggy.
Vaseline, kid.
No,
Or stay.
So,
You need to get a dry cloth or something.
Oh, I have one of these cloths.
You're frozen on my screen for some reason.
Oh, well.
well, Allison, now that you look your best self, you said you would lead this discussion about outreach to seniors about programs that are available.
Right.
Are you up for that still?
Sure.
Oh, wait a minute. Now, wait, what's this? Is this a new subject?
Well, do
It's on
you
the
have the
agenda.
agenda in front of you?
Yeah.
Really?
No, I didn't hear what you just said. Do I have the agenda in front of me? Of course not.
Oh, okay. Well, if you have the agenda, it says discussion of outreach to seniors about available programs, and Allison is the designated leader of that discussion.
Okay.
So the Nantucket Wheelers trained and had started working with the residents at our Island Home twice a week for bike rides. Our Island Home shut down. And so we were looking for people to participate or who wanted to go for rides. And Vanessa, do you have anybody?
I can ask,
Yeah.
but I can't guarantee.
And so I asked Sherry Hunt if she knew anybody who was, like isolated or, because it's really it's a program for getting people out and about. And so I was in touch with a bunch of people that I know, and they didn't want to, two people in specific that have Alzheimer's, and it was too stigmatized for them. They didn't want to be pushed around in front of a bike. Which I was shocked by, but
I know when I trained for it like 3 years ago, and the route that they went, there's a lot of bike paths that like the trees had like grown in. And so like the bike paths itself, it's all really rocky. But the course itself was in fact like safe and all the protocols. However,
Allison, oh, I'll be next.
Yeah.
Can you write something up and send it to Marianne? I'm kind of like trying to get her to, put news in the newspaper, stuff
Right.
like that.
Well, what I'd like to see is, besides Sherry Hunt, it would be great to have a database or to be able to reach out to find people who are isolated and could use a ride in a wheelchair or something. I think part of what we should be doing is being a resource for if people have services that they want to share with elders, shut-ins, with whomever, they can come to the Council on Aging. And I was shocked that Sherry Hunt who works with all of the people involved with elder services couldn't come up with anybody who wanted to go for a bicycle ride. So I don't know, again, it's identifying people in the community that could use services, and that's.
How hard is it to get on the bike?
You can be, it's not hard at all. It's a wheelchair.
Because I know a lady who lives next door to me, and she's 92 or 93. She has terrible Parkinson's. She won't go out. She won't eat with anybody. She just sits in her chair. And because she's too embarrassed and because she's shaky. I was just curious to know how hard it would be for her to get in the chair.
Well, part of the training is helping people get from a wheelchair, from a walker to a wheelchair, but,
Yeah.
you know, I don't know when the.
Curious, I don't know.
Yeah, but like, is she on a list anywhere of someone who would appreciate an outing or a visit or a blah, blah, blah?
Well, her brothers, they're 83, I think they're 84 and 93, and they never married, and they live with each other, and they're so cute. But he still drives and takes her around and stuff. It's very difficult. She's sort of on a walker and has a hard time moving. And
So what is their support system? Who do they go to for?
she gets Meals on Wheels now.
Yeah, but they're, it's just identifying people like that and hooking them up to services that they need, because they could probably benefit by more than just Meals on Wheels. But they have to go to this, they have to be in touch with Sherry Hunt or with Pascon or with someone to not necessarily qualify, but to learn about things.
Doesn't
that
the
are
fire
available.
department have a list of all the quote unquote seniors that's on the, you know what I mean, that live alone, maybe? I don't know.
Yeah, you know what, I didn't think to call the fire department. I thought Sherry Hunt would have the people who would be most, who would need an outing more than anybody else.
But that's only if they reach out to her. She doesn't go and seek them. It's people that she has on her list that have already reached out to them.
Right.
So the fire department is right. Susie, do you think your people would want to be, contacted? Some people don't like that.
I don't know. I could find out, and I could give them Sherry Hunt's name.
The other thing is that the Meals on Wheels people do more than just drop off a meal. Their job is to observe what's going on and make suggestions and interact with these people, not just dump a meal on them.
Right.
I think they get dumped a meal.
Not if it's Rocky Fox.
Yeah.
If they're getting Meals on Wheels, that comes through Sherry Hunt. So
Right.
those
Okay.
people are already affiliated with
They
Sherry.
are Sherry Hunt's team, but they're not supposed to just drop the meal. They're supposed to interact with the recipient of the meal.
And
You
also,
get a Rocky Fox over there.
and also the Meals on Wheels is
Uh-oh, lost you.
Kendra,
I'm getting feedback, so I don't want to talk. I'm hearing myself.
now I'm not. Anyway, I was just shocked that we couldn't find anybody to go out on a ride. We have all these trained volunteers and everything's all set to go, and we can't find anyone to ride. So
What about Laura's newsletter?
what
It
would-
reaches 550 people.
Yeah.
Send me something, Allison, and I'm happy to put that. in the
okay, all right.
Pretty great.
Steve, we took Steve out on that. Meryl had one of the bikes and stuff, and he loved it. But I know him, he was also embarrassed, it is, he doesn't play well with others anyhow, but I'm just saying that it's also, like you said, a stigma to that. So there is.
Once people try it, they love it. It's just
Yeah.
putting them on the first time, and also having their, a guy that I work with, his wife was embarrassed to put him on. Here he's got Alzheimer's, he's really well along. He wouldn't have any idea that but his wife said, oh no, he'd never want to do that. So
Allison, could you take your television program out of the studio and ride along?
I think we did one time. There might be a Wheelers on the road. I'll check and see.
Because that way you could show other people how much fun it is if you get a really good, fun person sitting in the seat.
Right. The I&M took pictures the very first ride this year, and they didn't put it in the paper yet, but maybe I'll ask them.
Or a YouTube video or something like that that you could put on Daybreak.
Yeah, well, since we don't have anyone riding anymore,
Well, that's what, just go pick somebody who's a fun person, a fun elder person to do it.
I'll
And
come over, Ally. You can ride
okay,
me.
all right, Kendra, have fun. Well, that's a good idea. But, you know, it would be nice to be someone, if it was somebody who really needed it, but I'll get back to, I'm working with Tony and Cynthia Cahill on Wheeler stuff, and, yeah, I'll get this feedback back to them. But anyway, you know, when we start doing the memory cafes, it would be great to have a list of people who can share or who would be willing to support things like this. And that's all I have to say about that.
thank you so much.
You're welcome.
The last thing on our agenda is my usual report on what's going on with NCEA. And I have nothing to report that everybody doesn't already know. Everybody knows what's going on inside the salt marsh, which is moving along at a snail's pace, but it's moving. So there's actually nothing else that anyone would care about. You don't care about their bylaws that they're making changes to. So I have nothing to report on that.
Can you let us know in the salt marsh what has been fixed? Did they end up putting any more doors to close the rooms off? Or I know they upgraded the bathrooms, but what else has been done there?
The doors did arrive and they have been installed, so they open both ways because it's a fire door, so they're very cool. They need to be painted or primed, something like that. The electrical guys came in today and put up the exit sign to get out of the great room since it's now a fire door, and they put in the outlets, and the windows are supposed to arrive mid-August. So it's really, we're waiting for stuff to get here for them to do the work. It's
So, so the accordion doors, for instance, those pull things, those are gone, right?
That's gone.
How do you
Correct.
separate the rooms?
There are two doors that swing like this. I can go take a picture of it and show it to you. There's two doors in the middle that are they're like saloon doors. So they'll open both ways. They're full. They have, I don't know, 15 lights maybe. And then on either side, there's windows, but the windows have not, the actual insert windows haven't arrived yet. So we're still not really separated, but it's just because things are so slow to be manufactured and get here, et cetera. So, which is fine. We're doing great. Not a problem.
Good.
The view is beautiful.
Great.
It does brighten up everything with more light coming in,
I bet
and
it does.
you know, there's no rug. It's now a floor. You now hear everybody on the floor.
Laura,
walking,
can you send a picture? I think I'd love to see that. Do you
Sure.
mind? Okay,
I
cool.
will send a picture to everybody, what
Thank
it
you.
looks
Did
like.
they do anything to the ceiling for sound at all, considering it's a
No.
wooden floor?
No, and it's not really noise. It's just you hear people walking. You know, when there was a rug, you didn't hear people walking.
Yeah.
They're gonna do the ceiling and the fans and the lights probably sometime this winter, because we felt as the employees, like, why open? Because we were closed for so long, why open and then close right away? So we'll close when it's slower, and we're trying to kind of maybe convince them that they don't have to take down the ceiling, which from what I understand is going to be a horrendous job.
They want to take it down because why?
Because there are stained panels up there, and you can't buy those panels anymore, replace them. So we're trying, NCEA is trying to, or their contractor guy who's on NCEA is trying to get NCEA just to paint them, because it's a huge job to take the ceiling down. You don't know what.
Yeah. I think that's a good idea. Have them come in and spray paint them.
Yeah, just paint it, put in, and they want to put in new lights. We could use new fans because they're very slow. So we'll see what happens, you know, come November, December. And it'll probably take 8 months to get a fan. So Don't hold your breath. But, it's fine for us, we're happy. And I think the members are too, they just want to be in here. At this, I don't think at this point they care what it looks like. They just want to see their friends.
That's great.
Yeah, but I'll send a picture.
So are there any other topics that anybody wants to mention that are not on the agenda? I see you're out. Okay. Kendra, I want to thank you very much for being willing to be the secretary today.
Okay, I took it in shorthand, so hopefully you can read my little squeaks and squat. No, I'm kidding.
We'll all look forward to it. Thank
It's
you.
got I'm hungry on it.
Thank you, everybody. With that, I'm going to ask somebody to move that we adjourn the meeting.
Ooh,
I
me.
I second it.
Vanessa, who will second this?
I will,
Kendra.
happily.
To everybody.
Stop talking.
We had such a nice time. It was very, very fun and not so strict and official. Not that I want to say anything.
We'll work on that for future meetings too. Thank you.
Thank you.
everyone.
All right.
Thank you.
Bye,
Thank
y'all.
you. Bye-bye.
Bye.
Hello.
Hi,
Hi, Kendra. How are you?
good, how are you?
I'm good. Is it